Right, welcome to the module Managing Performance in Healthcare Setting. So in this particular presentation, we're going to look at the performance management cycle in healthcare. Our focus is going to be on the hospitals and some of the organizations that are implementing health intervention programs. So by the end of this presentation, I expect you to understand the fundamental principles and components of performance management cycle in the healthcare settings, identify the key stakeholders involved in the performance management cycle within healthcare organizations, describe the purpose and importance of performance management, improving healthcare delivery and the patient's outcomes, and finally, analyze the various stages of the performance management cycle, including goal setting, performance monitoring, feedback, evaluation, and finally, improvement planning. So having looked at the learning outcomes, now let us focus on the management cycle in healthcare. We're talking about the performance. So the performance management cycle in healthcare setting is a strategic framework that involves a systematic process of planning, monitoring, reviewing, and developing the performance of healthcare professionals to ensure the delivery of high-quality patient care. So the healthcare professionals we are referring to here are the medical doctors, the nurses, the midwives, the lab technicians, etc. So it's very important for us as admin of the hospitals or some of the organizations which are dealing in healthcare setting to make sure that the performance of these professionals are managed. All in all, we are ensuring that the patients are supposed to be recovering at a high rate. But if the patients are not recovering, there's a high rate of death. It means that the individual doctors, the nurses are not performing well in the organization or in the hospital setting. Therefore, the conclusion will be the hospital is underperforming, the organization is underperforming. So, in this particular context, we are going to look at each of the steps, beginning with planning. So, under planning, we are talking about objective setting. You need to set objective before you even think of managing the performance of your employees, the doctors. Under objective setting, we are talking about what do you expect of your employees? What do you expect of your nurses, the midwives? So in this objective setting, we are talking about the initiation of the lab of the cycle involves setting clear and measurable objectives aligned with both individual roles and the organizational goals. When talk of the individual roles, we're talking about the job description or the daily activities the doctors, the nurses, the midwives are doing in the hospital or in the organization. We need to set it clearly. And then it has to align with the organizational goals. In the setting of hospital, what is the goal of the organization? We are talking about the patient's care, recovery rate, reducing the death rate, etc. These are some of the goals of healthcare organizations and the hospital. So we make sure that we align the individual goals or individual roles with the organizational goals. So these objectives serve as a benchmarks for evaluating performance. You cannot evaluate the performance of your doctor if you have not set the objective or the target you expect the doctor to do. So as a manager, you need to make sure that those objectives are clearly set so that you can benchmark or you can evaluate the performance of your employees against the set standards. So that's about objective and planning. So we're still under planning stage. We talk about the SMART objectives. When talk of SMART, we are talking about being specific, measurable, achievable, relevant, and time. That's what we mean by SMART objectives. So for instance, goals could include reducing patient waiting times. So when a patient is brought in the facility, the person should not be there for more than 2-3 hours waiting for a doctor. That is what we call underperforming. The person might end up dying in the process of waiting for a doctor. Okay, so as a manager in the organization or in the hospital, make sure that you set a smart or specific goal whereby the person should not be in a line waiting for a doctor or for a nurse for more than even 3 minutes, because we are talking about life. Seconds, 1 minute, someone can lose his or her life when he is not attended to in time. So that's the objective we are talking about. Then another one is also increasing vaccination rates. We need to make sure that the rate of vaccination given to the patient or to the people or to the vulnerable group of people actually increasing. If the rate is not increasing, it means the hospital or the organization is also underperforming. So basically, that's about setting smart objective, making sure that the objective we are setting is specific, measurable, achievable, relevant, and time bound. That will also make the doctors, the midwives, the nurses to be motivated. Otherwise, if you set an objective which cannot be achieved by the end of the day, no one will be willing to take up on the job. Okay. If you set objective which is not specific, it is just wide, people will be confused. They don't know exactly what is expected of them. So being specific helps a lot in terms of motivating the doctors, the midwives to perform their duty very well. So that's about setting smart objectives or goals and planning stage. The next stage is now identifying key performance indicators. So in the hospital settings, we are talking about recovery rate, reducing the death rate. That's the performance indicator in the hospital. For example, you can talk about patients' outcomes. The patients' outcomes here, we're talking about, of course, I've explained about reducing the death rate, increasing the recovery rate, and also reducing the time a patient is waiting to see the doctor. That's very important. The person is struggling with life, but if the doctor does not come and attend to that person in time, of course, that person might end up losing his or her life. So these are some of the indicators we use. The time the patient is waiting to be attended to by the doctor. Then the next one is adherence to protocols. Healthcare has some protocols to follow. It's not like any other business whereby you can jump from one step to another. For example, if a patient is brought in the facility, you cannot start injecting the patient without first examining what is the real cause of the problem or the sickness. These are some of the protocols we're talking about. The patient has to go through the formal protocol of administering the treatment. If it is about consultation or seeing the doctor, and the doctor will recommend. If it is about taking blood sample or any other sample from the body to be taken, then the examination has to be done, and then the doctor will have to prescribe the medicine specifically to address that problem. So if it's about admitting the patient, it should come out after examining the problem and then also the extent of the problem. Because not all patients are supposed to be admitted in the facility. It depends on the degree or the extent of the sickness. So these are some of the performance indicators we are talking about under planning if you are to manage the performance of doctors and the midwives in the hospital or healthcare organization. So we're still under planning. Now you need to establish development plans. So after identifying the indicators, you need to develop a plan. So you need to identify training needs and formulating plans for skill development and career advancement to support healthcare professionals in achieving their objectives. So when you discover that maybe some doctors are not performing to the expectation, they are not doing well in a specific area, you need to give them the necessary training. Because if you don't give them the necessary training, they will never develop as individual and the organization will never perform. The performance we're talking about is, of course, dealing with the patients. So you need to make sure that if you identify that one of your employees is having some weaknesses in one particular area, make sure that a training is organized for that particular employee so that his skills can be improved on where he or she is not doing well. So it's part of managing performance. You can't manage performance if you don't have a training program in place to help the underperforming employees to catch up with the rest of the employee in the organization. So we're still continuing with the planning stage. The next one now is the tailoring development strategies. So you need to personalize the development plans. It's not that every employee has the same weaknesses. The doctor might have weaknesses in one area and then the nurse will have it in another area. So you need to make sure that you personalize your development planning. You personalize you are training program to make sure that the individuals who are not doing well in such a field is actually trying to do better. So make sure that as a manager, don't give training to each and every employee without analyzing where their problem is. If you give a training to someone who's already doing well in a specific field, for example, if you're talking about attending to the patients in time, maybe consultation, so that person is already having the skills. He's already doing well in that particular area. If you give him training in that area, you are wasting resources. He will not be motivated because he already knows what he or she is doing. So the training becomes, in this context, irrelevant to that person. You better give it to the person who is really in need of it. So that's about tailoring development strategies and planning still. So the next stage in managing performance of doctors or nurses, midwives, is monitoring. So you have already planned, you have set the objectives, you have identified the performance indicators, etc. Now the next thing is to monitor. So under monitor, we do what we call continuous assessment. So you need to regularly monitor the performance against predetermined objectives. Remember, at this point, you have already set the objectives or the targets to be achieved by the doctors, by the nurses. Now you are trying to monitor whether they are really performing according to the expectation or they are performing the way you expect them to perform. You are now comparing the performance indicators. Are the patients recovering? Is the death rate reducing? The time the patients take to meet the doctor, is it much, or it is just as soon as they come to the facility they are attended to? So these are the things you are now monitoring as an admin or as a manager in the hospital or in the healthcare organization. Now, after continuous assessment is still under monitoring, the next thing now is the data collection and analysis. So you need to utilize data-driven approaches to collect performance-related data, analyze trends, and identify areas for improvement. So you keep on recording if it is through performance appraisal or if it is through just writing observation, whatever method you're using to collect your data, you need to now identify areas of weaknesses. For example, you can say that I've been observing that the doctors take long to attend to the patients. That's already an area of weaknesses. And as a manager, you don't need to leave it just like that. You need to make sure that you train them, you do something to make sure that they really attend to the patients in time. I've already explained to you the importance of attending to the patients on time. It is about life. The person has come to the facility to seek help in order to recover. But if you don't respond to that person on time, then chances are high that the person may end up dying. Not because of the sicknesses, but because of your weaknesses of not attending to that person on time. So make sure that doctors always attend to patients on time whenever they are brought to the facility. So that's about that data collection and analysis and monitoring as a part of managing performance. The next one is feedback and the communication is still under monitoring. So you need to provide continuous feedback to healthcare professionals based on their performance, data facility improvement, and the motivation. So after you analyzing the performance of the healthcare professionals, give them the feedback. Let them know how they have been performing. If you don't give them the feedback, some of them will be worried. They might think that they are underperforming, yet in reality, they are doing well. So make sure that the feedback is given back to them. If it is negative or positive, let them know. And if it is positive, this will motivate them to continue working hard to make sure that they keep the momentum high. And also, if it is negative, it will also make them to try and improve on the areas where they are not doing well. Actually, this is a very important point. Because if you just keep it for yourself, there'll be a lot of anxiety. Okay, people will be anxious to know how their performance are. So that's about giving feedback to your doctors, the nurses, the midwives, the lab technicians, and also other support staff. We are basically focusing on healthcare professionals, but you need to know that we have other support staffs in the hospital or in the healthcare organizations. If I talk about the administrators, they don't actually directly interact with the patients, but they make sure that everything is in place for the patients to recover. They make sure that the doctors are there to attend to the patients, and also they make sure that the logistical arrangements, if it's about ambulance to bring the patient to the facility, it is there. Even the askaris, they also play a very important role in terms of providing security to the patients. We have the cooks who are responsible for taking care of the food to the employees. Sometimes even in some hospitals, they cook for the patients. Okay, so these are some of the people you need to look at. However much you are focusing on the healthcare professionals, we don't need to ignore the roles of other support staff also. So they are part of this presentation. Actually, we also need to evaluate their performance. We also need to plan for their performance. So that's about feedback and communication and monitoring. Now, the next one is reviewing. After you have planned, you have been monitoring the performance of your doctors. What next? You have to, of course, continue reviewing their performance. So, under reviewing, you have to schedule evaluation. So periodic formal evaluation, this is what we call now the performance appraisal. It can be done annually or quarterly, depends on the organizational policy of appraising their employees. So this is very important. This helps you to check errors. This helps you to see whether the performance is maintained or it is going down, and to find out exactly why it's going down. Okay, this helps you also a manager to make sure that you develop a training plan to make sure that those who are not performing well are brought to the same level with the rest of the organization. So it's basically about performance appraisal, checking the performance of the individual employees against the set standards. Remember, in planning stage, we talk about setting objectives, identifying key performance indicators. So the performance indicator we're talking about here, the rate of recovery, okay, the time the employee spent, the time the patient spent to meet doctors. These are some of the indicators we look at. So you evaluate the performance against those indicators. Okay. So after evaluation, we also have what we call comprehensive assessment. So you need to assess individual performance against set objectives. Okay. You can look at a doctor, how he is performing. You go to the nurse, how she or he is performing, the midwife, the lab technician, and of course, don't forget the support staff, how they are performing. All these contribute to the overall well-being of the patient. So it is an individual responsibility. It's not just about the doctor taking care of the employees. It involves each and everyone who is working in the organization. So that's about a comprehensive assessment of individual as a part of reviewing employees' performance. So it's still under reviewing. We're talking about now identifying success and the challenges. So one is the recognition of achievements. So you need to acknowledge exceptional performance and accomplishment in meeting or exceeding objectives. This helps a lot to motivate the person who has performed extremely well. And also, it will motivate others, especially those who are underperforming, to make sure that they also perform well, so that in the next season, they will also be recognized. So that's the advantage of recognition of achievements. Another advantage is that it acts as an element of motivation. If a doctor is doing well and you acknowledge or you recognize him or her for the work done, the person feels appreciated. The person feels motivated. Okay, he feels that his energies, his efforts have been appreciated by the organization. But if you just ignore the performance of that such a doctor, chances are high that he or she could even leave the organization because the organization is not acknowledging his or her performance. So it's very important as a manager to make sure that you recognize achievements in an organization. It can be done yearly. Most organizations, they do it yearly. they have what you call Employee of the Year. They give a small prize if it is about maybe certificate of recognition. That's enough. But the funny thing in African context is that when talk of recognition of achievement, people think about money. So it's not about money. It could only be the certificate, the paper, okay, to recognize their performance in that particular organization. So the next one now is how do we address the challenge? So you need to identify obstacles or challenges facing during the evaluation period and devising strategies for improvement. The challenge we face during the evaluation or the performance appraisal is one, we can talk about biasness. Okay, the person who's appraising you might be biased. Maybe I have some issues with you at home or somewhere, and then you bring in the issue here. Instead of appraising my performance fairly, you end up bringing issues which are not related to work. These are some of the challenges we face in evaluating employees' performance in an organization. So that's about the challenge and reviewing. The next one now is adjustment and adaptation. So you need to make necessary adjustment in objectives. Okay? If you've discovered that employees are underperforming, you need to see why are they underperforming. Maybe the job description or the duties they're doing it is complex. Maybe they are doing a lot. So you need to adjust by either reducing the job description or making some slight improvement in the job description. That when they come to work, everything becomes very easy. That's about adjusting the objectives. Also, the strategies can be adjusted and then the resources based on the review outcomes to optimize future performance. So when talk of the resources, it can be cost or money, or it can also be the equipment, the machines they are using in the hospital. So if you are using outdated machines or in the hospital, chances are high that the doctors might be underperforming because of the inefficiency of those equipment. Okay, so as a manager, you need to find out exactly the root cause of the performance. If it is because of the inefficiency of the equipment in the hospital, you need to make sure that you purchase or you procure the latest equipment which can help the doctors to deliver the services, which is basically patients' care in that context. So that's about adjustment and the adaptation. Then the next stage in performance development cycle is we're talking about developing performance. Now, you have planned, you have monitored, you have reviewed. Now we are going to develop the performance of the employee. So one activity you need to perform here is to identify the performance gaps. The performance gaps is the weaknesses against what? The set standard. People are not performing to the expectation. You expect the patients to be recovering all the time. You expect the death rate to go down. You expect the time the patient spends to meet the doctor to reduce, but it is the opposite. The death rate is going high. The recovery rate is reducing. The time the patients take to meet the doctor is actually 3-4 hours. So these are some of the gaps we are talking about here. So under that gap, you need to do assessment of current performance. Okay. So you need to conduct a thorough analysis of individual or a team performance against a set objective and the key performance indicators. It could be one person. Okay. Because treatment is a process. Maybe the person who's supposed to meet the patient for the first time is the one delaying the whole process. The patient cannot go to the lab for testing without consultation. If the person who's supposed to meet the patient for the first time is delaying, it means that the lab technician is also going to delay. What is he going to do? Nothing. So you need to find out exactly where the problem is coming from. Is it from the consultation room? Is it from the lab? Or is it from the ward? So as a manager, it's very important for you to know where the problem is. Then later on, you can also evaluate it as a team. You get all of them to see why are they not performing. Then the next one is identifying skills gaps. So you need to find out why is the doctor taking long to attend to the patient for the consultation. That's what we call a skill gap. Maybe the doctor doesn't know the importance of attending to the patients in time, if that is the case. Okay. Why is the lab technician always bringing in controversial results? Someone is having malaria, but the result is coming negative. What is the problem? There is skill gap there. Maybe the lab technician doesn't know how to do the examination. Okay. So it's very important as a manager to identify such kind of gaps so that you make sure that you fix them. Otherwise, if you keep it like that, you're not burdened with it. At the end of the day, the hospital is going to fail to achieve its target. The organization is going to fail because of only one person who is giving controversial or negative results when the sickness is actually there. At the end of the day, the patients die, but the result is showing that the person is not malaria positive, but in the reality, the malaria is there. So we need to identify such kind of gaps. So it's still under development. You need to set clear objectives. We have been talking about SMART. Okay, you need to establish objective which is specific, measurable, achievable, and relevant as part of your development plan. If someone is not performing, is showing a negative results when actually the patients are having malaria. So what do? You need to make sure that that person is taken for. One is further training, very important. Some people think that if you're not doing well, the only option is to fire you. That is also there. That's another approach. They can fire the lab technician and then re-advertise for that position. But other people will make sure that they take the lab technician for further training to make sure that his skills is actually updated. So you need to align the organizational goals. That's another thing. Whatever the doctors are doing, whatever the nurses, the midwives are doing, it should be aligned with the organizational goals. In this context, is about zero death, reducing the rate of death, increasing a recovery rate of the patients, reducing the time the patient spends to meet the doctors, etc. So that's what you call aligning with organizational goals. So these are some of the things we need to talk about when we are on setting clear objectives. The next one is tailoring development strategies. Of course, I've been explaining this. You need to customize or personalize it. You cannot give training to someone who already has the skills. That training will be useless in terms of the skill gain, because training is all about gaining this skill. But if the person already has the skill, but you have been forcing the person to go and to undertake the same training, then there's nothing learned because the person already know what he or she is supposed to do. Okay. Another thing is it's going to be wasting of time. You waste 3-4 months training someone who already has the skills. Then finally, of course, wastage of resources. We are spending money on a knowledge which is already existing. So as a manager, make sure that you personalize or you customize the training plans to the individual employees in an organization. The next one is training and skill enhancement. So you need to offer targeted training, workshops, or mentorship programs to improve a specific competency. Okay. So the doctors, the midwives will be allowed to attend workshops. You need to assign someone to mentor them so that they can learn from. All this is doing, we are all doing this to make sure that we improve or we develop the performance of the individual employees in an organization. This will help the hospital, the organization to achieve its goal and the objective. Otherwise, if you ignore this, the end result is, of course, you know what happens in the hospital setting. If the doctor doesn't know what he or she is doing, of course, the person dies. Okay, so we're all doing this to make sure that the patients receive the care they deserve. The patients are recovering. The death rate in the country is reduced. So it's still under development. We have talked about tailoring development strategies for several times. I think that's where we are going to have the end of this presentation. Unless you have a question or something to add on, then I will have to welcome that.